Hello, I'm Dr. Brandt Gibson, and today I'm going to talk to you a little bit longer about peripheral neuropathy because it's important, I think, after 67, 68 days of talking about peripheral neuropathy, giving you additional steps, giving you additional options, things that you can do to really get control of your peripheral neuropathy. So when it comes to peripheral neuropathy, you want to look at it kind of in this way, because most of you are probably sitting there going, okay, nobody's giving me really good information, nobody's telling me what I can do, what options there are, and in most cases I'm being told there is nothing that can be done, and so I'm looking for options. Or maybe you're frustrated because you're having such significant pain that it's keeping you from sleeping or it's keeping you from doing the activities that you want. The idea is that you just have to look for an individual, a specialist in peripheral neuropathy that will give you more information. There's really four different areas that you want to look at when it comes to peripheral neuropathy and getting control of your peripheral neuropathy. Number one, you need to understand what peripheral neuropathy is. You need to really get control of it and say, okay, what is peripheral neuropathy? How is it affecting me? And what's going on that way? Number two, you need to manage the symptoms. You need to find ways that you can actually get control of the symptoms of peripheral neuropathy so you can actually really handle it. Number three, you need to control the nerve damage. What's happening in most cases with peripheral neuropathy is you're damaging the nerves and it's getting worse over time. And so if you don't stop that damage, you continue to have increasing symptoms, increasing problems from your peripheral neuropathy. And then fourth, once you have those three steps, those three pillars in place, then you can actually learn the little mini steps, the daily routines, the things that you're supposed to do so that you can gain control of your peripheral neuropathy and really thrive, live an extraordinary life and not have the limitations that are happening from peripheral neuropathy. So let me go through a couple of those in a little bit more depth. Number one, we were talking about you need to understand peripheral neuropathy. So what is peripheral neuropathy? Well, it's a malfunction of the peripheral nerves. It's not absence of the peripheral nerves in most cases. It's a malfunction where the nerves start to not function like they're supposed to, and they're either sending a bad signal, they're sending a slow or weak signal, or of course you can get loss of signal, but in most cases it's a bad signal the brain's misinterpreting, a weak signal or slow signal that's causing you to not have the normal sensations that you should have. So what are the peripheral nerves? How do you know if it's a peripheral neuropathy or not? Really what it comes down to is you have the central nervous system, which is the brain and spinal cord. You have the peripheral nervous system, which is all the other nerves coming off the brain and spinal cord. And it's these nerves that are included in peripheral neuropathy. So the peripheral nervous system is separated into voluntary and involuntary portions. The voluntary portions of peripheral neuropathy is the somatic nervous system, and that includes large fiber and small fiber sensory nerves and motor nerves. And then you have the involuntary portion of the peripheral nervous system, which includes the autonomic nerves. So you can have a peripheral neuropathy that includes any of the four: small fiber sensory neuropathy, large fiber sensory neuropathy, motor neuropathy, or autonomic neuropathy. And any of the symptoms that come with any of these four will be a problem. So as you're getting into the fact that you've been diagnosed with peripheral neuropathy, you need to say, okay, what type? Do I have a small fiber sensory neuropathy? Do I have a sensory neuropathy? Or do I have just a motor neuropathy? Or do I have just an autonomic neuropathy? And have they all been tested? Have they all been looked at? Because it's very, very important that you do look at them and get the different diagnosis and determine what's going on. So as you're looking at the sensory neuropathy, did you just do a nerve conduction velocity test? Because that only shows you a large fiber neuropathy. Have you done an epidermal nerve fiber density test to evaluate your small fiber nerves? Have you done nerve tests that are testing light touch and protective threshold and vibration and temperature sensation and position sense and balance? I mean, have you done all these tests to actually determine if you have a peripheral neuropathy or not, or what type of peripheral neuropathy you have? Have you done ultrasound or x-ray to evaluate if you have a compression neuropathy? I mean, really, you need to understand what type of peripheral neuropathy you have and what the options are based on those types. And then the next step is you say, okay, number two, I want to manage the symptoms of peripheral neuropathy. The most common way that most people are managing the symptoms of peripheral neuropathy is through medication. They will usually get a Lyrica or gabapentin, or even sometimes narcotic pain medications, even morphine, and I have seen in some individuals. And they're really not doing much more than just managing the peripheral neuropathy, the symptoms of peripheral neuropathy, by stopping them, saying, okay, I'm going to interfere with those symptoms. Now, medications can work. The nerve modifying medications like Lyrica, Cymbalta, gabapentin can help, and they can reduce pain significantly, for example, when you're sleeping, but they also have significant side effects. So a lot of times we look for other options. That being said, narcotic pain medication and most of the pain medications are not super effective at treating peripheral neuropathy, and because of the side effects and the addiction potential and so forth, they're not usually a good option, because the best case scenario, most of the studies are showing that at 50% improvement of your neuropathy pain is all you can hope for, best case scenario, and most people are not getting even that. So as you manage the symptoms, you want to look for options based on the type of neuropathy you have. And one of the things that we found to be very effective is a form of electrical stimulation called CalMare. And through this CalMare treatment, we can actually reduce the symptoms, reduce the pain, and get pretty good relief of those symptoms. But really when it comes down to controlling or managing the symptoms of peripheral neuropathy, it's going to be one of 4 areas. So one, the question is, do you need to re-educate the nerve? That's what CalMare does. It's getting the nerve to send the signal correctly to the brain, and the brain to interpret it correctly so that you actually stop having the symptoms or the pain that's associated. Do you need to repair the nerve? A lot of times that's done through vitamins or nutrition or certain types of lasers and so forth to repair those nerves. Number 3, maybe it's a matter of resetting the nerve. You're doing an electrical stimulation to reset that nerve and cause it to do more like what it's supposed to. Or number 4, you may need to repress it. We use this quite commonly when you want to manage the symptoms of peripheral neuropathy, because there are things that need to happen. So how do you manage the symptoms of peripheral neuropathy with repression? Meditation is one option. There's a process called anchoring, where you can actually anchor other symptoms in place. You can actually say, okay, there's other things that I can actually do to anchor happiness or joy or whatever that I can pull out when I'm really uncomfortable and really having the disability and discomfort and distraction that comes with peripheral neuropathy. So anchoring is another method. There are other psychological techniques that you can actually use to focus on and alleviate those symptoms. It's very, very valuable and very important that you get some of these techniques in place to help you repress these symptoms. Number 3, the other part that we commonly will talk about is controlling the damage. But you need to know what's damaging. You need to know what's causing that damage. And it really comes down to saying, okay, what disease processes do I have? Do I have diabetes? Is it sugar that's causing the problem? Modifying or managing the sugars can improve your peripheral neuropathy. Maybe it's a thyroid problem, and if you treat thyroid disease, they've shown that neuropathy improves. Is it a vitamin dependency or deficiency? Is it a compression neuropathy, where you can actually reduce the compression and neuropathy improves, like with the carpal tunnel syndrome? Really what it comes down to is saying, okay, what are the causes? What's causing the nerve damage, and how do I control it? And if you work on controlling it and understanding what's causing it and then controlling it, you could actually get to the point where your neuropathy is not progressing and it's not getting worse, and it gives you better options and better resources to actually resolve and improve your peripheral neuropathy, so that you could actually get to the 4th one, which is thriving with peripheral neuropathy. And then it comes down to, what do I need to do daily? And part of that's understanding completely how your peripheral neuropathy works. Does it bother me more at night? Does it bother me first thing in the morning? Do I notice it in the middle of the day? What are the things, what are the pieces that I need to put in place so that I can reduce those distractions or those problems, and so forth? So the idea is you need to have all 4 of these pillars, all 4 of these legs of the stool, to really get control of your peripheral neuropathy. And what I want to do is give you resources that will allow you to do that. There are really several different ways that you can do that. One is you can say, well, let me just start with number 1. I want to just get really good control, good understanding of my peripheral neuropathy. And there is a master class, there's a process where I can take you through and help you really understand what peripheral neuropathy is, and get a better handle on your peripheral neuropathy by understanding this piece. So if you're interested in that masterclass, I will put a link at the bottom underneath this video to allow you to say, okay, I can go to the masterclass and I can watch it and determine if it's going to be valuable to me. Number two, if you really want to get control of it, you say, okay, I want to go all in. I want to say, okay, I don't want to just learn about and understand peripheral neuropathy. I want to understand it. I want to manage it. I want to control it. And I also want to thrive with it. Then there is a 90-day boot camp, the Gibson Method 90-day boot camp, which takes you through this whole process and says, let's get control. Let's go through this process. Let's find out all the information I need to know so that you can personally walk through this. Now, one of the keys to this 90-day boot camp is that on a weekly basis, I will get with you and I will talk to you and I will help you get your questions answered and teach you new information. And we can continuously update this information so that as you're going through it, we can keep going forward and saying, okay, let's give you what you need to have to truly get control of your peripheral neuropathy. So this is Dr. Brandt Gibson, and this is your Neuropathy Nugget, although it's a little bit longer than a nugget. This is your Neuropathy Nugget day 68. And I'm trying to give you the tools to truly get control of